I'm Dr. Susan OReilly. I am the CEO of the Dublin Midlands Hospital Group and a member of the eHealth Ireland Committee. For me, digital healthcare, the vision will ultimately be the ability to have single points of data entry and multiple points of access to shared data, whether it be for clinical purposes, so the ease and accuracy of moving laboratory data, diagnostics and clinical records around between different locations in individual hospitals and across hospitals, or whether it be utilizing financial, human resource and performance management data in a simple, comprehensive manner. Well, I think the thing I'm most passionate about, and I think everybody in ICT is as well, is in completing the rollout of the unique health identifier. This is the tool that will allow us to do everything else that we need to do. So that is my priority. The second element that I'm very keen on seeing developed is the new National Maternity Clinical Record System. And there's a whole range of other ICT projects that are bubbling up as very important. But in the interest of time, I won't go into great detail on them right now. Absolutely my iPhone. I'm sure everybody says that. So I think that's a vital tool for me, and I'm also very attached to all of my computer equipment, and I'm looking forward to getting a pad that I can use as well. That's been ordered, yeah. Well, first of all, I'm strongly in favour of patient having access to all of their clinical information. It can be a little bit scary for clinicians, doctors and nurses to understand that everything that's in a medical record could be visible to the patient. However, I think there is a learning curve for patients. There's a training period where they inevitably will interact and ask a lot of questions, but in the longer run, that ease of access to their own information, their lab tests, their diagnostics, their appointments, will actually streamline and simplify everything from the patient's point of view. It'll give them a sense of empowerment. There will be times where they're confused that the terminology used is too complicated, but quite honestly, I think the time saved by having that access and portability will more than offset the initial engagement the clinicians will have to explain some of the information to the patient. So I think it's a powerful tool. I've had some experience with it working in a Canadian setting, and I think there's really very little to be afraid of with it. So I think for the organization, patients will be able to explain their story much better when they know their own information, and especially if they're in an environment where the healthcare provider may not have immediate access to that information. There are two big strategies that our hospital group wishes to accomplish, and technology is the key enabler. First of all, we do want to build clinical networks. For example, we've already built an obstetrics and neonatology clinical network between the Coombe and Portlaoise Hospital. However, we're still struggling with integrating the transfer of information. We then want to roll out a whole range of medical networks around geriatrics, renal medicine, endocrinology, cardiology, all the ologies, and we want to be able to share the information so that patients get the more routine treatment, lower acuity treatments close to home, and the more complex treatments in the bigger hospitals that have the facilities to do so. So that's one strategy. The second big strategy is integration of our acute hospital services much more closely with the community services and with GPs in the primary care world, so that the information transfer is seamless. GPs constantly complain they don't know what's happened in the hospitals because they don't get to hear for weeks until letters might arrive. We sometimes struggle to get the GP information into the hospital environment around medications the patients are taking and a whole range of other elements. So exploiting the already evolving e-referral process, electronic pharmacy process, and it's not just with the GPs and the smaller hospitals and support systems, it's also with pharmacies in the retail environment. There's so much opportunity there to make things work well.